I've been a swimmer since I was about 6 years old. My mom threw me in the pool because I had no fear at the time of anything and they didn't want me to drown, so that's how I learned how to swim and it just became a part of my life.
Well, Jake got into swimming because his sister had been taking swimming lessons. Being as there are a lot of birthday parties when kids are younger that are at a pool and stuff, I thought, man, he better take lessons.
I first met Jake as a homeschooler, came in for swimming lessons when he was 5 or 6 years of age, and then he got involved in our aquatics program, and it wasn't until he became an 8th grader at McCallie that I got to work with Jake again.
When I was 10 years old, I won my first big race, I guess you could say, and that's just kind of when it took off.
Jake was 10 years old when he won his first 2 events at Southeasterns. It was a long course meet. It came as a surprise. He won in the 200 free and he dropped 5 seconds in finals. And I think he realized that he could do this and he could do it well.
So when I was started to consider high school, is definitely I wanted to be able to swim. I was already on a club team, McCallie GPS Aquatics, and so the head coach, Stan Corcoran, he taught me how to swim.
As an 11 and 12-year-old, he was one of the best swimmers in Southeastern swimming, and he has stayed that way. As a 13, 14-year-old, as a freshman, he almost broke our school record in 100 backstroke.
The summer of his freshman year, he swam at the NCSA meet in March, and he swam a 2:05 long course in the 200 back. And I didn't realize how fast that was for he was 15.
In Jake's sophomore year, we got a call. He said, I got a guy that I want you to follow. And I don't get calls from Stan often, but when I do, he's always right. The prospects always develop. And so I definitely took notice and we started to follow Jake. In the beginning, his times weren't anything of note, but that endorsement from his high school coach meant a lot. And then sure enough, he began to develop.
He scored at the state high school meet as a freshman. He scored every year at the state high school meet. He left McCallie an 8-time All-American, high school All-American. He's qualified for junior nationals.
He's got this ability to close. Like at the end of a race, he's never out of it. He could be in 7th place and you can't count him out. He could still win. By his senior year, he put himself in a position to be able to make our Big Ten championship team as a freshman, which is not easy to do with the number 3 team in the NCAA rankings.
It was a Sunday morning. Coach Looze got on the phone with me and I committed. I told him that I wanted to be a part of the family. And then I announced later that night, and it was so surreal because I never really thought that I'd be able to commit to such a great school. I felt like I was in a good place with swimming. I was in a good place with life. I felt like I was kind of on top of the world at that point. So I first noticed something was wrong on a Thursday, and it was in practice. We were going really hard, and I looked down at my arm, and my right arm was a different color. I didn't really think much of it, just because I was going really hard. I felt really hot, so, typical hard practice. And so I didn't really think much of it. And then Sunday I committed on April 8th, and I felt great. I went to go take my commitment picture, and I started to notice a little something then.
We look at his pictures that were taken on that day, and there was nothing that would indicate that there was anything going on with his arm at all.
I woke up Monday morning and we had a lifting session, and so I went into practice and I did not think I could lift. So I went to the trainers.
So yeah, we would go like this, we would typically...
I had him compare bilaterally. So whenever you're in medicine, you look at bilaterally, you look at the other arm. Is it really discolored or is it not? And so I looked at his hand bilaterally, and it in fact was darker. Sometimes what happens is a muscle will start to occlude, or it'll stop up a vein or an artery, and that can cause a lack of flow of blood. And that's what I first thought it was. And so that day I said, hey Jake, after class, I want you to meet me down in the athletic training room before you swim, and we'll try to work this out.
On Monday, he came home from school, said it was kind of sore, maybe a little bit swollen, but he was sore a lot. That wasn't necessarily an unusual complaint.
As a physician in cardiovascular disease, as well as Jake's dad, I didn't want to think that he could be having something serious when he first complained of his arm hurting. So when Jake said his arm didn't feel right that first night, I said, let's keep an eye on it, Jake. Maybe it's just the muscles being sore.
Tuesday morning is when it really kind of hit me. I woke up and I was unable to raise my arm above my shoulder. It was twice the size of my left arm. It was a darker color than my left arm also. And there was a lot of pain. I felt fine physically other than that, so I was able to go to school. And then I had anatomy class with Coach Bass.
He was sitting there and said, Coach Bass, is it normal for your arm to be swollen or discolored a little bit? And I said, no, no, it's not. And that's when we kind of realized there's something going on with his arm that was not right. There's a muscle known as the Pectoralis Minor, and it's deep to the Pectoralis Major. And usually what we'll do is we'll have the athlete stretch out their arm, we'll go underneath or just beneath the Pectoralis Major. And you can feel the Pec Minor, and sometimes it gets really, really tight. And that tightness of that muscle will clamp down on an artery or a vein. When I first started to massage, I put my fingers underneath his Pec Major and put it on his Pec Minor, and it was instantly very, very painful. He actually said, stop. And that was then that I noticed that there was something that was a little bit wrong, more than what I had the ability or the expertise to actually take care of. And that was when I told him, I said, you need to probably get this checked out as soon as possible.
So I met him at the orthopedics office right after school, and he ended up going to the ER to have ultrasound. And even though the tech couldn't tell you, you could see on the ultrasound that he had clots.
I kind of was watching it. It was about 20, 30-minute ultrasound that they took. So I was able to pick up on some things. He was looking at some good veins, and I could see blood was pumping through. And then when he pressed down on my subclavian, I could tell nothing was passing through, and they'll do a little thing where you can see the blood going in and the blood going out. And I could see that there was nothing going in, and I was kind of like, wow.
There were clots that completely filled his arm from his shoulder down to his elbow. And it wasn't just in the large vein, it had migrated into all the little smaller vessels as well.
My subclavian vein and axillary vein were compressed by a ligament that attached to my first rib too close to the subclavian vein, and it became inflamed and pinched it. More specifically, it's known as Paget-Schrotter syndrome. When you think of blood clots, a lot of times you think of death. And that was definitely the first thought that raced through my head was, am I gonna die? And then the next was, will I ever swim again? I drove myself home because we had 2 cars there, and my dad was there with me in the ER. He looked at me when they told me and they had left before they were discharging me. He's like, everything's gonna be okay. We're gonna get you the best help you can get. But I was kind of confused. I was like, how does he know that everything's gonna be okay? I was terrified. I didn't want to go to sleep. I didn't want them to wake up without me there. I didn't want to die.
We spent the night before we went to Dr. Fugate's office. My husband and I were up the entire night. We had watched multiple YouTube videos talking about the procedure that usually is done, which is decompression, the removal of the first rib. And we couldn't find information that would say, okay, this person had this and this is what they ended up doing. There was nothing of that. There was a lot of technical literature talking about the actual surgery, the actual procedures and stuff, but nothing about what do you do then? So yeah, we went in there not really knowing what to expect. And Jake for sure did not know what to expect.
When I first got the call about Jake, the diagnosis was Subclavian Vein Dvt, or deep venous thrombosis. The venous type we see almost exclusively in young, typically athletic patients who do a lot of repetitive overhead motion. So it's very common to see it in pitchers, swimmers, volleyball players, sometimes just people who are really strong who do a lot of weights. So we'll see it occasionally in football players as well. But the venous type is more typical of your really athletic folks. A deep vein thrombosis is an acute blood clot within the deep venous system. So we have superficial veins and deep veins. Superficial veins sometimes you can see on the, beneath the surface of the skin, and then there are deep veins are what you'd think about the larger veins that drain the extremities and the trunk eventually back to the heart. So when I got the call with a little bit of patient background, I had a high suspicion for thoracic outlet syndrome, or the acute presentation we sometimes call effort thrombosis. We worked him in shortly thereafter, confirmed the findings on the ultrasound that he did have deep vein thrombosis in his subclavian vein. And then the diagnosis of venous thoracic outlet syndrome after that is purely clinical. So if I have a young, healthy, strong guy who is a high-level swimmer like Jake with a DVT like that, then that gives me 99% certainty that that's what's going on.
I had just committed the next 4 or 5 years of college to swimming. At Indiana, I was on top of the world, and just all of a sudden it's like, where do I go from here? I have nothing. And it kind of broke me down a lot inside.
When an athlete gets their sport taken away from them, mentally it's devastating. I never wanted him to feel like he didn't have a place on the team, that he couldn't swim. I wanted to make sure that he understood that wasn't going to be taken away.
The head coach called my parents, and he told them that him and his wife woke up and prayed for me. And that was something that just was like so meaningful to me.
The first part of treating this problem is a lot of conversation. It's not a very common diagnosis, and so the explanation of what's actually going on becomes very important. So to describe what caused the problem and then what we can do about it. My immediate concern for him, as with most of the folks that show up with this, is let's do what we can to alleviate the current symptoms, which are the pain and swelling related to the deep vein blood clot. So we do what's called a venogram and then thrombolysis. What that means is use ultrasound guidance to go in one of the unaffected veins in the patient's arm, go through that vein to the deep vein in the upper arm, the subclavian vein, identify where the clot is, and then we have a lot of mechanical and pharmacological means of breaking up the clot. So that's what we did for Jake, really upon presentation. So we did his procedure, cleared the vast majority of the clot, and what that does is it almost instantly, if not within the first 12 to 24 hours, really alleviates the symptoms of pain and swelling.
That morning when we went in to see Dr. Fugate, Jake left there not only feeling drowsy, but with some hope that there was at least a chance that he would be able to swim again.
The real important part for treating venous thoracic outlet syndrome is what comes after that. So you can alleviate the acute blood clot, the initial blood clot, but if you don't go on to treat the problem that caused it, that's the actual thoracic outlet syndrome, then it recurs at a high rate. So the thoracic outlet syndrome is basically a mechanical compression caused within the thoracic outlet, as you might guess, but it's a very tight space that we really all have anatomically, but folks who have a lot of repetitive overhead motion develop hypertrophy of some of the tendons and muscles in that space, and that's what leads to this extrinsic compression of the subclavian vein that makes them a higher risk for developing the clot. So the real therapy, the most important therapy, is thoracic outlet decompression, which we accomplish through first rib resection and anterior scalenectomy. The first rib has to be removed because that's part of the area in which the subclavian vein is compressed. I think when all of us think about ribs, we think about a really long bone in our chest, but as you move up the thorax, the first rib is actually a pretty short bone because it extends from the sternum in the front to the cervical spine in the back. So that's actually, it ends up only being a length about like that. And then you have some muscular attachments, most particularly the anterior scalene, which attaches from the first rib up to the side of the cervical spine. So you remove part of that muscle. And then the most important part of the procedure for the venous thoracic outlet syndrome patients is the subclavius tendon, which is what gets hypertrophied or enlarged with the repetitive overhead motion that they have. So we do all that procedure through a small incision in the axilla or the armpit, and we're able to really visualize those structures well and accomplish that with a fairly straightforward operation. The main barrier to getting back to the athlete's normal activity is pain. So when you go through a surgery like this and you have pain in the affected area, you know, your instinct is to not use the affected arm. So I have a lot of people who, you know, want to sit in this position for a long time after surgery. And some of that is okay. It's to be expected. You need time to get your body and your brain around the pain. You know, you need some time to rest and recover. But I encourage people early on to start doing physical therapy. So our normal post-operative routine is about 2 weeks after. I have patients start doing a very specific physical therapy regimen that's mainly focused on flexibility, range of motion, and then strengthening. This is not like a complicated joint repair or a shoulder replacement where you can damage the repair. I mean, my job is to remove the structures, and then once you're able to tolerate the pain, you can't really do much to damage it. So I think Jake really took that to heart, both from a mental standpoint and from a recovery standpoint afterwards.
When it came to rehab, my support system stretched from Dr. Fugate, my surgeon, to my parents, to Coach Bass. Coach Bass was definitely the more hands-on physically with me, working on gaining my range of mobility back. He worked on massaging my scar and helping me to feel less and less pain.
If we can get his range of motion back, if we can get the swelling down, the pain to go away in the short term, we can get him back in the pool as soon as possible so that he can actually get that wet skin and feel like he's an athlete again, because psychologically that hurts, that kills an athlete.
Jake was very interested in doing anything that he could in order to get back to swim again.
In addition to surgery, physical therapy, moving the parts, the appropriate time to get back into the water, it's very important that we treat the endothelium, the part that's been damaged.
My mom definitely took a more nutritious aspect of my rehab. She definitely helped me rework my diet.
So we basically looked at what he ate and took out anything that causes inflammation.
I went to eating more greens, more salads, more fruits, more vegetables.
For each fruit or vegetable serving you eat per day, you can improve your endothelial function by 6%. For instance, if you have 4 servings of greens, that improves it 24%. That is awesome. Now, what would hurt it? We know that fatty foods hurt the endothelium.
That meant taking away pizza because we know that dairy can cause inflammation.
So we tried to get Jake to move away from fatty foods. Lots of these healthy fruits, vegetables, nuts, and grains. It also helps with antioxidants. Remember, when your body is damaged, it makes inflammatory mediators, free radicals. We wanted to have the body treat this by antioxidation in the body.
My goal personally was to get him to eat 7 to 9 fruits and vegetables a day, looking for lots of antioxidants, looking especially for greens, which help the endothelium expand, which can carry more blood and oxygen. And that's a lot of food. We go for 2 or 3 servings of fruit in the morning. At night, a big, huge salad with, one of those 5-ounce containers of greens and whole cucumber, whole pepper, broccoli, carrots.
Hydration, very important. If you get dehydrated, stress on the body, the veins contract, they don't have as much flow. Now, Jake was getting one of the best ones ever, and that was exercise. You know, he was getting plenty of exercise and movement that increased blood flow. Just blood flow across the endothelium improves its function as well.
And rest. So important. To bed, no screen time. To bed, sleep a good 9-10 hours if he could.
And we really focused on, you know, being positive. You know, it's one day at a time. Get him back into the water as quick as we could, but as safe as we could. Introduce these nutritional supplements that could help his endothelial function. Get him to understand what was going on in his body. Now, it's still a challenge every day when he feels good to realize the damage is still there and it hasn't gone away. So with your athlete, in addition to ongoing treatment with physical therapy, being positive, eating lots of fruits, vegetables, nuts, and grains, maybe supplementing with some chestnut or turmeric, it's important also that they realize that they're not out of the woods. This is something they have to continue to do, and they might have to do it the rest of their lives.
So I returned to the pool about a month and a half after my diagnosis, which was shocking. It was about a week after my third surgery that I returned, actually, which was the part that was most surprising to me.
He started out doing a quarter of a practice, then he moved up to a half a practice. He still had swelling in his arm, so he would get out after the warm-up set and hang his arm and let some of the swelling go down, and then he would get back in the water and finish up the main set.
I wasn't able to swim at first. I was only able to kick, and I was only able to do it for maybe 30 minutes. It was hard. It was really hard emotionally. I know a lot of the time when I was kicking, I would cry under my goggles because I didn't know if I'd be good again.
He swam his first competitive meet on June the 22nd. So if you look at the timeline, we had April, May, June. You know, after his third operation, in June, he was swimming.
The times weren't great, but I was able to complete a race that I didn't think I was going to be able to complete. It was at that meet I was like, hey, maybe I can do this.
By the end of the summer, before he was ready to go to summer juniors out in California, he still wasn't doing a full practice. So basically, when he went out there, it was just kind of to see where he was. And he went out there and he dropped time.
I remember junior nationals out in Irvine, California, and I said, hey, Jake, don't put any expectations on yourself. You're fortunate to be at this meet. I have no expectations. And then he makes the A final.
I had no expectations, and I went 6 best times out of my 7 swims, and I was kind of like, hey, I'm back. But I was never back to normal.
So he went back to school in the fall, and in the first meet, he was swimming 5 events, and the first 4 events he swam great. And the last event was the 200 free, and he started out, the first 50 was good, and then it was like he was in slow motion. It's like he could not lift his arm out of the water, and it was just painful to watch. So the next morning, we went to Dr. Fugate's office again, and he had an ultrasound and another venoplasty, and this time, all the swelling left his arm afterwards.
He had such a good summer, and I was like, all right, we're over this hurdle, and he's going to be able to really train hard in the fall. And, you know, we had several setbacks and several times where he wasn't able to do as much as what I was hoping that he could do.
I personally didn't feel a lot of pressure, mainly because I was doing it because I love swimming. I was coming back because I wanted to swim. I didn't care how I did. I just wanted to be able to do it again. But I definitely think my coaches, they wanted me to continue to work harder and get back to where I was before. And so they would push me some days and I wouldn't be able to push. And so I'd push back and be like, hey, I can't do this. And I mean, it was definitely a frustrating process.
Our coaches are pushing our boys, and that's what they do, and they're good at it. And we sometimes have to kind of pull back the reins a little bit on the coaches and say, look, physiologically and science-wise, this is what's happening in the body. They can't handle it. And they were very receptive to that.
And I talked to him several times. I was like, Jake, you know, if you can do more, you should do more. And if you can't do more, then that's okay. But I said, you know, if you say, well, I can't do anything right now, and you can, that's on you. I said, I don't know. I'm going to trust you to make the right call. I'm going to trust you in what you're doing.
And so they would push me some days and I wouldn't be able to push. And so I'd push back and be like, hey, I can't do this. And I mean, it was definitely a frustrating process.
I really didn't care whether he swam fast or not. I know it was important to his psyche, so I wanted him to, but more than that, I wanted him to stay alive. I was trying to think long term. What are the things he can do now to be well when he's 20, 30, 40, 50? And that's what I was focused on. If swimming was that, great, I wanted to swim well. But if swimming would compromise that, I would say, no, it's not worth it when you're 30 not being able to move your arm well.
I think the biggest thing is listen to your body. Even if a doctor says you're okay and your body's telling you you're not, or a coach is telling you you need to push it but you feel like you can't, you listen to the coaches, you listen to the doctors, you listen to those who are mentoring you, but you also listen to your body and you make sure that you're doing what's right for you.
I just felt support from everybody. I know my mom, she changed her entire philosophy about me swimming. She used to be that typical swim mom that was only concerned about the times, and that changed. That first meet back, she cried. And I think she was able to look at it, and she's told me several times, I'm able to look at you swimming and don't care about the time. And I'm just happy that you're able to do it again. And that was something that was very helpful for me because I didn't feel the pressure to come back. I was doing it because I want to. About 10 months after my injury, we had our state championships. And our goal as a team was to win. We weren't supposed to win. SwimSwam, the swimming website, had us projected to get third. They scored the meet. We were supposed to get third behind Maryville High School and Baylor School. And Baylor's our rivals, and we really didn't want that to happen. I remember telling my mom going into finals when she was asking me, what's your game plan for this race? How are you going to do it? And I just told her I'm not taking this for granted.
Well, I mean, Jake was a big part of our state championship team when we went there. I mean, he was on 2 relays that one made automatic All-American and set school records. He won the 200 free and got second in the 200 back. So if we wouldn't have had him at the state high school meet, we wouldn't have won the state high school meet. So that was a pretty exciting way for us to end our short course season.
Having the team come around, everybody, that helped me step up and be able to swim. But also, it was an amazing feeling, just everybody coming together and being able to get that goal. We were counted out. I was counted out. I didn't think, I was not supposed to win. I wasn't supposed to be there. And it that comeback felt really good to me. After our state championships, I had junior nationals. I told my coach, I'm gonna go a 142.80 in my 200 back. That was kind of a goal I set my freshman year to go my senior year. I was nervous. I was like one of the only times I've ever been genuinely nervous to where I could throw up before a race. And I was nervous for it, but at the same time, I just kept thinking back, I'm not supposed to be here. I'm not supposed to be able to swim. And so it was kind of like, wow, like I told my mom at state, I'm not taking this for granted. I'm just gonna go out there and do my best.
Rockwood Swim Club is Jack Dolan, and he has that white cap in the center of the pool. He is making some kind of statement here. Lane 4, boy, look at Marcum coming back. Marcum wants a piece of it. He might get him at the touch. Oh my gosh, Marcum came out of nowhere. 25.22 on his last 50. 142.80 to 142.91. What a great race for the kid from McCallie. Gotta love that.
I definitely feel like since the injury, I'm happy. I'm genuinely happy with what I'm doing. I'm having fun with what I'm doing. I grew a lot closer with God during the process. I know a lot early on, I was kind of like, hey, God, what's going on here? Why is this happening to me? And I struggled a lot to have trust in His plan for my life. And then as time went on, those little milestones I would hit in my recovery, like I was able to get in the water and kick today. I was able to get in the water and swim for 5 minutes today. I was able to swim for 10, 20, 30, and as my time moved up, those little milestones were something huge for me, being able to see His plan for my life. And I grew a lot closer with my friends. I could have died if we didn't catch it in time. And so kind of my relationship with my friends, my family has grown a lot. My time in the water, it's sacred to me. Every time I jump in the water, I kind of have a little flashback in my head that reminds me of when I was sitting in that ER and the doctor was like, hey, you have blood clots. And that feeling, oh, I'm never gonna be able to swim again. That just runs through my head, and it's just kind of like, hey, I'm here now. I'm able to swim, I'm blessed. Use this opportunity, enjoy the moment, enjoy your time in the water. That's something that was huge for me.